Hi guys, hello, I am Jewel and welcome to my channel. Today's article is taking blood pressure measurements properly is vital to patients' health. This information is coming from the National Kidney Foundation, so let's get started. New Perspective Piece gives physicians, patients guidelines on getting the best result. New York, December 18, 2019. Accurate blood pressure readings are only as good as the techniques used to take the measurement, according to a New Perspective piece published today in the American Journal of Kidney Disease, AJKD, by the Kidney Disease Outcome Quality Initiative, KDOQI. More than 100 million U.S. adults have hypertension, high blood pressure, the majority requiring pharmaceutical treatment, and the disease is prevalent in people with chronic kidney disease, CKD. Controlling blood pressure remains the most important intervention nephrologists or any caregiver can provide to reduce kidney disease progression and prevent strokes and heart attacks, says Holly Kramer, MD, co-author of Blood Pressure Measurement, a KDOQI Perspective, and the president of the National Kidney Foundation. However, without accurate data, decisions can be erroneous and lead to adverse outcomes. The authors Paul E. Dortz, MD, Cervenza Bedu, MS, Dr. Kramer, Michael Karutz, MD, Michael V. Rocco, MD, and Paul K. Wheaton, MD, of this article provide an update on the best practices for measuring blood pressure in the office or clinic and for assessment, and the best way for patients to take blood pressure measurements at home. The best clinical practice often starts with the simplest of details, such as the best practices for blood pressure measurement, Dr. Kramer said. The 10 minutes to review this KDOQI commentary by Dr. Paul Dwartz and Dr. Paul Wheaton could prevent hundreds of hours addressing errors and adverse events due to inaccurate blood pressure readings. Simply stated, improving blood pressure measurements in your clinic will improve the delivery of care in your clinic. The authors stress the importance of training patients on the variable nature of blood pressure and how to interpret measurements. For example, an empty bladder and the position of the patient's feet can affect the reading. The article explains primary care professionals, PCP, should also spend time training their patients who measure from home the best practices to take a reading, how often, and how to keep a record of the reading for their primary care physicians. The measurement of blood pressure is one of the most important aspects of a clinic visit for patients with CKD, said Dr. Dwartz, co-author of the commentary. Blood pressure is inherently variable. It is important that the technique for measurement blood pressure does not introduce even more variability. Implementing a process to measure blood pressure per the guidelines from the American Heart Association can provide patients and clinicians with the assurance that they are basing decisions regarding diagnosis and management of hypertension on blood pressure readings that were similar to those obtained in all the landmark clinical trials that inform clinical care. Okay, guys, this was taking blood pressure measurement properly is vital to patients' health. I found this article very, very interesting because, as you know, hypertension is one of the leading causes for CKD. And to find out that, taking a blood pressure assessment through the clinic or hospital or your doctor's office is only as good as the technique of the person that's doing the blood pressure reading, which is very, very interesting. And as a CKD patient, and all CKD patients know, wherever we go, blood pressure readings are one of the first things that are taken, through any assessment for all of us. So to find out that blood pressure readings may be wrong, they may be off, is very interesting, because this is something that I'm not even sure that a lot of clinics know, that that they might be taking blood pressure in an improper way. So I think that this situation is on the physicians and the clinics to learn the proper way from the American Heart Association to give proper blood pressure readings, and to pass along the knowledge to us as patients of CKD, so we will be better equipped to do a proper reading for our blood pressure. Guys, this is one of the great things about research from the National Kidney Foundation, because it brings and finds so much valuable information that can help us, all of us, with CKD, and many people with high blood pressure, in other chronic diseases, find the best solution for the problem of blood pressure. So this article tells all of us that we are getting better, through assessment and and all the things that other people in the background are doing, through research, helps all of us with our situation. So research, of course, you see, is very, very vital to all of us that have CKD, and basically all of us that are attached to the health system through all of our chronic illnesses. So I'm very, very grateful for these researchers, because this may help all of us with CKD better tune our blood pressure measurements, so they will be more accurate for doctors to assess, exactly where we are, and how we're doing with our hypertension. So guys, if you found this article as interesting as I did, please like, share, and subscribe. And as always, always sending you so much love and affection. I am so grateful and so thankful that there's so many people working, for us and with us to find the best ways to treat, CKD, and to help all of us improve our overall health. And guys, of course, the only thing that we have to do as CKD patients is to stay compliant with our doctor's orders always. They know this disease, backwards and forwards, of course, and they're learning every day through research the best ways to treat us. So it is for all of us to listen to them, and to be compliant with what they tell us. And also, of course, guys, for all of us, we have to stay positive, in this disease, and hopeful, because we never know, what's coming around the corner. You can get that call any day that, tells you to come to the hospital, like all of us did to have a transplant. So, guys, like I said, you have to stay positive and hopeful, because, that's life. Life is, it can be a struggle for many, many of us at times, but it is still very good. So guys, take care of yourselves, and I will see you on the next video. Bye.